Hey George, it's Dr. Buford. I'm here with Mitch and the rest of the team. We're getting started on the left knee. We're looking in the medial compartment. That instrument you see spinning around is called the shaver. It has suction attached to it. And here on the femoral condyle, you can see the cartilage here has an area that's a little bit cracked. I'm going to turn off the suction for a minute and see how loose it is. I don't want this to generate any more loose pieces. You can see how that could cause problems by catching in the joint. So we'll just try and smooth this down a little bit so it doesn't catch. Pause for a sec. Okay, so we've smoothed this out a bit and taken away the obviously loose pieces. I don't want to take away too much. But I sure didn't want to leave anything loose that was going to cause more pain. And then we look in the back and we can see this torn meniscus back here. We can start with our shaver just to trim out some of it, but then we'll probably use a pair of scissors just to fine tune it. There you can see where it's split. And so we'll take a pair of scissors. My output is about halfway. So you can see how these scissors work just to kind of quickly trim out the part of the meniscus that's no longer any good. Awesome. Okay, we're just about done on this medial side. You can see how we've had to trim this meniscus back so that it hopefully won't cause any more problems. There's still a few loose pieces that we're just using our suction to remove. And then here's that area in the condyle that we had to smooth out as well. Just want the margins here to be stable. So I'm happy with that. We'll go ahead and look in the notch here, which is where some of the big ligaments are, the cruciate ligaments. And we'll move a little bit of the soft tissue so you can see. But there's the ACL, or the anterior cruciate ligament. That looks pretty good. In just a minute we're going to reposition the knee and look in the lateral compartment. Pause please. Okay, now this is the lateral compartment. Meniscus here is in pretty good shape. We're still using our suction to make sure there's no loose pieces that we're leaving behind. There's your popliteus tendon running up towards 1 o'clock on the screen there. And this inner edge looks pretty good here. There's really no problems there. You can turn on the suction. You can see how it's pretty stable. Nothing's moving. Cartilage is in better shape than the medial side. I don't see any areas where the cartilage is real torn or loose. As far as the articular cartilage goes. A little bit of fraying on the tibia, but that's microscopic just about. So we'll go off in the video. We'll keep looking here. We'll show you some more in a little bit. Okay, so this is a patellofemoral joint. There's a little bit of a wrinkle on the patella up at the top, but it's not in the weight-bearing part of the bone, and it's really not unstable as you see here. So I don't think there's much to do there. As we look down the front of the knee, I don't see any significant problems here with the cartilage. That looks pretty good. So I think we'll keep looking around and maybe take one more tour around the knee just to make sure there's nothing else we can do and to make sure there's no more loose pieces. But I think we've seen everything that's important. If there's anything else to show you, we'll come back up on the video. But I think this is going to be it, okay? Good luck to you now. Bye-bye.